Pancreatic cancer is often referred to as a silent disease because it can progress unnoticed until it reaches advanced stages. However, recognizing early symptoms can prompt timely medical attention and potentially improve outcomes. In this guide, we will discuss 11 warning signs of pancreatic cancer, including 3 extremely unusual signs that many people have never heard of. By understanding these symptoms, individuals can take proactive steps in seeking medical evaluation and increasing the likelihood of early diagnosis. Number 1, persistent itching of the skin. Itching of the skin, medically known as pruritus, is an early yet frequently overlooked symptom of pancreatic cancer. It is particularly significant when associated with jaundice, a condition characterized by yellowing of the skin and eyes. Jaundice occurs when a tumour in the pancreas blocks the bile ducts, preventing bile from draining properly into the intestines. This leads to an accumulation of bilirubin, a yellow pigment that results from the breakdown of red blood cells. Normally, bilirubin is processed by the liver and excreted through bile, but when it builds up in the bloodstream, it can deposit in tissues, including the skin, leading to intense and relentless itching. This type of itching does not typically respond to over-the-counter antihistamines or topical treatments and may be one of the earliest signs of pancreatic cancer. The itching is often generalized but can be more pronounced in certain areas, such as the palms of the hands and soles of the feet. In some cases, it may appear before jaundice becomes visible, making it a crucial early indicator. If you are interested in this topic, state stitch and itching in the comments, and when I see it, I will give you a heart. 2. Unexplained bloating. Persistent bloating or an increased sensation of fullness in the abdomen is another warning sign of pancreatic cancer. This symptom is often dismissed as indigestion or gas, but in the case of pancreatic cancer, it may be linked to more serious underlying issues. Pancreatic tumours can interfere with normal digestion and the movement of food and fluids through the gastrointestinal tract. As the tumour grows, it may compress surrounding organs such as the stomach, intestines, or bile ducts, leading to a feeling of fullness even after eating small amounts. This can contribute to reduced appetite, discomfort, and weight loss over time. A more serious cause of bloating in pancreatic cancer is ascites, which is the abnormal accumulation of fluid in the abdominal cavity. This occurs when cancer spreads to the peritoneum, the lining of the abdomen, irritating it and triggering fluid production. Additionally, a tumour may block lymphatic drainage or disrupt blood flow, causing fluid leakage into the abdomen. Ascites often presents as noticeable abdominal swelling, discomfort, nausea, difficulty breathing, and a feeling of heaviness. Unlike bloating caused by diet or gas, this type of bloating does not go away with dietary adjustments or antacids and may progressively worsen. If you are interested in this topic, type dotting bloating in the comments, and when I see it, I will give you a heart. Number 3, persistent lower back pain. Lower back pain is a symptom that may indicate pancreatic cancer, especially when it presents as deep, persistent, and unresponsive to conventional treatments such as stretching, massage, or over-the-counter pain relievers. The pancreas is located deep within the abdomen near the spine, and tumours in this area can press against nearby nerves, particularly those in the celiac plexus, a group of nerves supplying the upper abdominal region. This compression leads to a dull, aching pain that often radiates to the lower back. The pain may worsen after eating or while lying down, as these activities increase pressure on the pancreas and surrounding structures. It is often more pronounced at night and during periods of rest, unlike muscular back pain, which typically improves with rest. If the cancer spreads to the spine or other bones, it may cause additional nerve irritation, leading to more severe and widespread pain. This pain can radiate from the back to the abdomen or sides, depending on the tumour's size and location. If you are interested in this topic, type tame back pain in the comments, And when I see it, I will give you a heart. Number 4, sudden onset of depression or mood changes. A sudden and unexplained shift in mood, such as new onset depression, anxiety, or feelings of hopelessness, may be an early and significant symptom of pancreatic cancer. Many patients report experiencing these changes months before any physical symptoms appear. Researchers believe that the link between pancreatic cancer and mood disturbances may stem from biological and physiological factors. One theory is that the presence of cancer alters the production of inflammatory chemicals called cytokines, which impact brain function and mood. Additionally, hormonal imbalances caused by pancreatic cancer can disrupt blood sugar levels, influencing brain chemistry and triggering depressive symptoms. Because these mood changes may appear before other signs, they should not be ignored. If you or a loved one experiences an abrupt and unexplained change in mental health, seeking medical evaluation is crucial. If you are interested in this topic, type depression recession in the comments, and when I see it, I will give you a heart. Number 5, unusual changes in taste preferences. Some individuals with pancreatic cancer develop a sudden aversion to certain foods, particularly those with strong flavours such as coffee, meat, or spicy dishes. Others report experiencing a persistent metallic taste in the mouth. These taste alterations may be caused by metabolic changes associated with pancreatic cancer. The tumour may affect the body's production of chemicals that influence taste perception or interfere with the digestive process, leading to a build-up of byproducts that alter how food tastes. This symptom is sometimes exacerbated by cancer treatments such as chemotherapy, which can further affect taste, perception, and appetite. The cause of these taste alterations is not entirely understood, but research suggests that pancreatic cancer can disrupt the body's metabolism, which in turn affects taste perception. The tumour may alter the production of cytokines, inflammatory molecules that impact brain function, including the sense of taste and smell. Additionally, pancreatic cancer affects digestion, leading to a build-up of metabolic byproducts in the bloodstream, which may contribute to altered taste sensations. Another possible explanation is the effect of pancreatic tumours on bile production and secretion. Since bile plays a crucial role in fat digestion and the absorption of fat, soluble vitamins, disruptions in bile flow can affect how food is processed and perceived by the body. For some individuals, these changes manifest as food tasting overly bitter or metallic, while for others, flavours may seem muted or off-putting. In more advanced cases, chemotherapy treatments may exacerbate taste changes, making it even more difficult for patients to maintain a healthy diet. If you or a loved one notice persistent and unexplained taste changes, particularly in conjunction with other symptoms, it is essential to seek medical evaluation. If you are interested in this topic, type great taste in the comments, and when I see it, I will give you a heart. 6, unexplained fevers and frequent infection. Pancreatic cancer can weaken the immune system, making individuals more susceptible to infections. Unexplained fevers may result from the body's inflammatory response to the tumour, as cancer cells release inflammatory proteins that cause a persistent low-grade fever. Additionally, malnutrition caused by pancreatic cancer can impair immune function, making it harder for the body to fight infections. Unexplained fevers and recurrent infections can be significant yet frequently overlooked signs of pancreatic cancer. The presence of a tumour in the pancreas can disrupt the body's immune system, either by directly affecting immune cell production or by triggering chronic inflammation, which weakens the body's ability to fight infections. Patients with pancreatic cancer may experience intermittent fevers that seem to have no identifiable cause, often coming and going. The inflammatory response caused by pancreatic cancer is one of the primary reasons for unexplained fevers. The tumour releases cytokines and other inflammatory molecules, which can elevate body temperature even in the absence of an infection. In some cases, these fevers may be mild and persistent, while in others, they may spike suddenly and be accompanied by night sweats and chills. Because these symptoms often mimic common infections or flu-like illnesses, they are sometimes dismissed until more severe complications arise. If you are interested in this topic, type infection objection in the comments, and when I see it, I will give you a heart. Number 7, swelling in the legs, deep vein thrombosis. Unexplained swelling in one leg, particularly if accompanied by tenderness, warmth, or redness, may indicate deep vein thrombosis, DVT, a condition in which a blood clot forms in the deep veins. Pancreatic cancer is strongly associated with an increased risk of blood clots due to its effects on blood clotting mechanisms and vascular health. If left untreated, these clots can travel to the lungs, leading to a life-threatening condition known as a pulmonary embolism. Welling in one or both legs, particularly when accompanied by tenderness, warmth, or redness, can be a sign of deep vein thrombosis, DVT, a condition where a blood clot forms in a deep vein. Pancreatic cancer is one of the cancers most strongly associated with an increased risk of blood clots. This is due to the tumour's ability to alter the body's coagulation system, making the blood more prone to clotting. Additionally, cancer triggers systemic inflammation, which can contribute to clot formation. The tumour itself may also exert pressure on nearby veins, slowing blood flow and further increasing the risk of clotting. DVT often manifests as swelling in only one leg, though in some cases both legs can be affected. The affected leg may feel unusually heavy, and the skin might appear discoloured, turning a reddish or bluish hue. Pain from DVT is often mistaken for muscle soreness or a pulled muscle, leading to delays in diagnosis. The swelling and discomfort may worsen after prolonged periods of inactivity, such as sitting for extended periods or lying down for too long. If you are interested in this topic, type thrombosis prognosis in the comments, and when I see it, I will give you a heart. Number 8, difficulty swallowing, dysphagia. Difficulty swallowing may occur when pancreatic cancer spreads to or compresses the esophagus. This symptom can result in discomfort when eating, a sensation that food is stuck, or even unintentional weight loss due to reduced food intake. Pancreatic cancer can cause difficulty swallowing when a tumour compresses the stomach, esophagus, or surrounding lymph nodes. As the tumour grows, it can narrow the esophageal passage, making it harder for food to pass smoothly. Some individuals may feel as if food is stuck in their throat, experience discomfort or pain while swallowing, or even choke frequently. In the earlier stages, this difficulty may only occur with solid foods, but as the tumour progresses, even liquids may become challenging to swallow. This symptom can lead to significant weight loss and malnutrition, as eating becomes an increasingly frustrating and painful experience. If pancreatic cancer spreads to nearby lymph nodes or other structures, the problem can worsen, further limiting the ability to consume food and maintain adequate nutrition. If you're interested in this topic, type "see dysphagia" in the comments, and when I see it, I will give you a heart. Number 9, persistent abdominal pain. Persistent abdominal pain, often radiating to the back, is a common symptom of pancreatic cancer. It may worsen after eating or when lying down due to the tumour pressing against surrounding organs. One of the most common symptoms of pancreatic cancer is abdominal pain that persists and gradually worsens over time. Unlike temporary digestive discomfort, this pain often originates in the upper abdomen and may radiate to the back. It can be dull and aching or sharp and stabbing, depending on the tumour's location and whether it is pressing against nerves, organs, or blood vessels. The pain may worsen after eating, particularly meals that are high in fat, as the pancreas plays a crucial role in digestion. Lying down can also intensify the discomfort because it increases pressure on the pancreas and nearby structures. As the disease advances, pain management becomes more difficult, and over-the-counter pain relievers may provide little to no relief. In some cases, the tumour may also lead to nerve irritation or compression, making the pain more intense and widespread. If you are interested in this topic, type faint pain in the comments, and when I see it, I will give you a heart. Number 10, nausea and vomiting. Pancreatic cancer can interfere with digestion, leading to persistent nausea and vomiting. These symptoms may be linked to bile duct obstruction, delayed gastric emptying, or the tumour's impact on digestive enzyme production. Nausea and vomiting are common digestive symptoms that can be linked to pancreatic cancer. When a tumour obstructs the bile ducts or intestines, food and digestive fluids may not move through the digestive system efficiently, leading to bloating, nausea, and frequent vomiting. This disruption in normal digestion can cause a persistent feeling of queasiness, loss of appetite, and an aversion to certain foods. In some cases, vomiting may be severe and occur multiple times a day, further contributing to dehydration and malnutrition. Additionally, delayed gastric emptying, a condition where the stomach takes longer to empty its contents, can develop due to the tumour's interference with normal gastrointestinal function. If nausea and vomiting persist without an identifiable cause, it is essential to seek medical attention to determine whether an underlying condition, such as pancreatic cancer, may be responsible. If you are interested in this topic, type limiting vomiting in the comments, and when I see it, I will give you a heart. Number 11, changes in stool. Changes in stool consistency, such as greasy, pale, or foul-smelling bowel movements, indicate malabsorption of fats due to insufficient pancreatic enzymes. This is a common symptom of pancreatic cancer and should not be ignored. Changes in stool consistency and appearance can be a crucial warning sign of pancreatic cancer. One of the most telling changes is steatorrhea, which refers to pale, greasy, foul-smelling stools that float rather than sink. This occurs when the pancreas fails to produce enough digestive enzymes to properly break down fats in the diet, leading to fat malabsorption. The undigested fat is then excreted in the stool, making it appear oily and difficult to flush. In addition to steatorrhea, pancreatic cancer can cause other abnormalities in bowel movements, including diarrhea, constipation, or alternating patterns of both. The presence of undigested food in the stool may also indicate a problem with nutrient absorption. Over time, these digestive issues can lead to severe weight loss, fatigue, and vitamin deficiencies, further weakening the body's ability to fight the disease. If persistent stool changes occur, especially alongside other pancreatic cancer symptoms, it is vital to seek medical evaluation as soon as possible. If you are interested in this topic, type rule stool in the comments, and when I see it, I will give you a heart.
Thanks for watching. If you enjoyed this content, don't forget to click on the video showing on your screen right now. Keep exploring, and I'll see you in the next one.